Hello everyone. For those of you who don't know me, my name is Nick Brooks. I have worked for the Department of Veterans Affairs for the past 10 years as a systems analyst. Most of that time I've been involved with the charge card and purchase card program for the VA. Today I'm going to talk a little bit about the charge card program, its responsibilities, a little bit about its history, and then an item or two that I feel could be developed further to help the program be more effective. There are a couple laws that were passed in the last 10 to 20 years that really has encouraged the development of this charge card program. The first one is the Paperwork Reduction Act of 1995. Now, the purpose of this law is to reduce the use of printed materials, mainly to increase information security. So there's not a lot of loose leaf papers flying around, and converting everything to electronic document format for, again, information security purposes. The second one is the Department of Veterans Affairs Simplified Acquisition Procedures, which aims to improve the efficiency of the overall purchasing process for the VA. Typically, when the VA would like to make a purchase, they have the vendor send an invoice to the VA, which then has to be paid either by check or electronic funds transfer. And what the move is, we're moving towards the use of purchase cards, such as Visa, MasterCard. The third one is the General Services Administration Smart Pay 2 program. This program is a federal government program also that encourages the use of purchase cards. It put a contract in place which partners with 3 major U.S. banks, so that each agency, such as the VA, Department of Defense, Homeland Security, can then work with one of those 3 banks to implement a program in its own agency. So now that we've discussed a brief background on why the charge card program is becoming so popular and why they've been formed, we're going to move on to the responsibilities of the department that I work in at the VA, which is the Charge Cards Operation Division. So one of our main roles is to monitor the use of purchase cards nationwide for the entire VA. Just to give you an idea, the VA has almost 1,000 facilities. This could be either medical centers, clinics, offices, and almost every single one of these 1,000 facilities has purchase cards. In total, there are almost 40,000 purchase cards now VA-wide. So we are in charge of monitoring all of those cards, which is quite a bit of work. We do have, this is important to note, a dual responsibility to taxpayers as a government agency, but also to veterans. So it's extremely important that the funds that we receive and that are used through this purchase card program are used appropriately. We're also responsible for a huge amount of rebates for the VA. When a medical facility, for instance, uses a purchase card to buy something, they get 2% of that total purchase price back as a rebate through the bank. And just to give you an idea, according to the Veterans Health Administration last year, this totaled over $65 million. So that is a significant amount of money that the VA gets back for using these purchase cards. And again, the department I work in has to ensure that these funds are received and distributed appropriately to the medical centers. And one of the final things I want to talk about that we're responsible for is ensuring that all of the purchases made on these cards are actually appropriate. You've heard, I'm sure, from the Office of the Inspector General, sometimes on the news, such as training conferences. The VA has not always, had the best oversight and what they've purchased, which is the reason my department was formed actually a couple of years back. But we are responsible to ensure that these purchases are appropriate. This requires that all transactions are approved and by management and the cardholder in the banking system. And if it fails to meet specific guidelines outlined in financial policy, then of course there are repercussions and disciplinary procedures that we also have to enforce. So, you know, the department has a lot of responsibilities, and we have been very efficient and productive, but there are a couple things that I think would help the department function more efficiently. And these actually center around training of the employees using all the purchase cards at the various medical facilities. There are two main options as far as improving the training structure. One of them is hosting webinars. Since we are spread out all across the United States, it's sometimes difficult and expensive to get people all together in the same classroom. With the use of webinars, we would be able to give instructions much like we're doing here via video or teleconference, and still, you know, be able to see each other, give feedback, ask questions. We think that would be probably the most efficient manner of training. The other option would be, like I said, in-person training. The bank will give these trainings free of charge, meaning they will fly in, put on the program, everything, as long as there are 25 people at the location. So that is one other option. Just to conclude, you know, I've kind of given you a brief overview of our responsibilities, a little bit of the history of the formation of the program, and a couple things we could do to improve the functionality and efficiency. I think as we continue to implement some of these things, and with some time getting some of the kinks out of our program, we will definitely be able to improve the efficiency and effectiveness of the program and using taxpayer money to support our veterans. Thank you.